Well, thank you very much. It's really hard to figure out how to make the case when the case, I think, has already been made this morning. And there's nothing much more I feel I can add, but I'm going to be, if people know me, I can be creative, innovative, optimistic, and sometimes competitive. So I want to say thank you very much to the excellencies and colleagues here. I'd like to amplify the words of our DG, who is committed to hepatitis and has made hepatitis elimination one of his flagship initiatives, and then to speak a little bit about what WHO as the health agency in the UN, what our role is and what we can bring to this discussion. And I would say also, a lot of people know me from being an HIV specialist, etc. But really, I've been congratulated for taking on hepatitis. And I can say it hasn't been difficult, because that's the challenge of, we have 2030, we have SDGs in front of us. If you look at the infectious diseases that we have, at least in the portfolio that I lead, HIV, hepatitis, and STIs, it is really the SDG we can make. And wouldn't we all be very proud if we could say, as a collective, we've been able to achieve that SDG? And so that's the competitive nature in me, is that I think we should be able to do this, but it's the optimistic nature. So in terms of the case of what WHO does, we do our best to look at all of the science, also bringing in the views of the community, the lived experiences, and bring that into guidance and strategies and recommendations. And you've heard the numbers: 350 million people living with HIV, with chronic viral infections. But let me tell you about what we actually have as tools, that not all of them have been spoken to. Number one, we have global health sector strategies. We've had strategies since 2016, when my predecessor, Dr. Gottfried Herschel, brought those forward. We now have a strategy that takes us to 2030, and it looks at the health sector, the commonalities, so you don't have to give up the UHC and the primary care, but you can still do the disease-specific work and make it work together. So that's the message we have to bring forward to ministries, to leaders, to our governments that need to take this forward. Secondly, we have prevention. Sometimes we talk about the tools for identifying, testing, and treating, but we have prevention tools, and we have to think about what was so effective in the HIV world is the demand of people living with HIV to not pass it on to their loved ones, and we've heard that from the community. So vaccination for hepatitis B, but also treatment for hepatitis C and treatment for hepatitis B, so one doesn't pass it along. So that's the demand element of, I want this for my own health, I also want it to protect public health and protect those around me. I think for hepatitis C, we'll have a very new price, or it's already been mentioned, and all in, you can do everything for $80. There is no reason we can't do this. But it needs to be done at scale. If we have small projects here and there, we may never be able to turn off that tap of new infections, where we get that effect of that you're not passing it along to your community. So that's another area where hepatitis C, I think this is something where we know where the new infections are. We've heard what's happening in the US. They've seen rising infections, and they've made a bold statement of saying, now we're going to go in and we're going to try to address and eliminate hepatitis C. I think that should be a challenge to other countries to say, we know we have hepatitis C, it's increasing in certain places, now let's make the challenge to turn off that tap of new infections and serve the people. Lastly, we also have data, and I think we haven't talked about data as an innovation or as a tool. We don't have enough of it, and perhaps Homi will be speaking to that afterwards, but we do have at least a framework that we should be collecting more data in countries, using that data to provide it to the ministries, to your ministries of foreign affairs, that this is something that's not just cost effective, it's cost saving. And within that, we now know what the indicators are for elimination. We know what a path to elimination might look like. WHO has put out a set of indicators for elimination. We'll be sharing very soon path to elimination so that there can be that healthy competition between countries. And that was something that was very effective in HIV, I think. If we put up a map and somebody wasn't treating people with the best regimen, and their map was red or not the du jour, there was a change, and country ministries went back and said, we want to do the right thing. And I think if we have that healthy competition on a path to elimination, that's another area where we need to maximize and find our way forward to bring countries together. There's another opportunity with the high-level meetings, and you've heard about also, there's a new UN group of friends led by those in the room, the Kingdom of Saudi Arabia and Egypt as well, where at New York, they want to take a political trend. We need to get the messages into the new political declarations, into the SDG summit, and ensure that those ministries are hearing it at the highest levels. So lastly, just to say, are there gaps? And what would I do if I got money tomorrow? There are a lot of gaps. I think what we don't necessarily share so often is we will say, okay, 10% have been tested for hepatitis B. 22% have been tested for hepatitis C, but we don't talk about the continuum of care and what that means. And we don't talk about that people can be tested and never see treatment and never see cure. So if I were to invest, I would say, let's talk about a cascade of care. Let's talk about getting to the end, not just the start. So I'd like to see testing, but I'd like to see cure. I'd like to see treatment resolution. I think another area, the treatment is prevention approach that we need to develop. And then we should be talking about liver health. Everybody has a liver, everybody has a heart. What are we doing to be able to make this real for people, that it's not just others who get this infection, it's all of us, it's our family members, which we heard, and I think it's an opportunity for us to talk about it more broadly and in a positive way. And I would have to say on a day that is remembering for anti-stigma, it's Iduabit today, and for those of you who know, it's a day where we are really recognizing that people are stigmatized for who they love, where they live, and perhaps the infections they have. And so if we can try to take hepatitis out of that and ensure that we're speaking about reducing stigma, getting access to testing and treatment along the way. So I think I've said my comments here, and I would just like to say I think this is a great opportunity to take whatever funds we have and go to the 10, 15 countries that are really the ones that have the greatest burden of hepatitis and make a difference in the next 4 to 5 years. Then I think we will be on our way to reaching the SDG goals. So thank you.